Hello and welcome to Guardian Talks on Guardian TV. My name is Fadima Rachel and today we'll be shedding the spotlight on a prevalent public health concern, malaria. April 25th is set aside to celebrate the World Malaria Day, a day dedicated to raising global awareness on this harmful disease that has claimed the lives of millions and thousands of individuals, particularly young children under the age of 5. In a report given by the World Health Organization (WHO), over 200 million malaria cases were recorded in 2023 and over 597,000 deaths were reported. In Nigeria alone, 1.4 million malaria cases were said to have taken place in 2023, and of course, 26% malaria death cases were recorded. However, the tides are changing for good this time. In October 2024, Nigeria received its first batch of the R21 malaria vaccine. This, of course, signifies the giant strides Nigeria is taking as a nation, and of course, the world system are all taking to ensure that malaria is eradicated completely from our health sector. Today, I'll be speaking with a medical doctor at Yaba College of Technology, Dr. Muyosore Akinola, who will be sharing her views with us on this malaria vaccine.
Malaria is something that is caused by a bite from mosquitoes, and it's something that is really serious in children because they are the vulnerable ones. So it's a big problem in Nigeria because Nigeria is an endemic country where malaria affects a lot of people, especially children, because it kills faster in children and other vulnerable people. So it's actually a big, over 200 million people are affected yearly. So yes, it's a big problem, especially in children. For children, if you are talking about day-to-day, almost every day we treat malaria cases for adults and children. But it's worse in children because children can't talk. They can't tell you, oh, I have headaches and all that. So it can, and then also, malaria has to do with the bloodstream. Like it affects the blood cells. So it can bring down the blood cells faster in children and can cause anemia, and this is how it causes death in them. So yes, it's a big issue for children. The vaccine is actually a good idea and innovation by WHO, and is being welcomed in the country. Presently, it's free in the country, and at the community level, yes, there might be some form of resistance from people, as in according to, there are some myths. Some people don't really like to accept vaccines easily like that, but it's something that works effectively and it is safe, especially in children, because the current vaccine going on now, that's the malaria vaccine. It's something that is rolled out for children now, children under 5, and yes, it works. This center is a health center too, just like every other health centers we have in the country, and we've been sensitized. It's been sensitized currently. We don't give it here, but we are being sensitized towards the vaccines, and it's targeted towards children currently. There's this information we get from WHO, yes, online. So we always get real-time information concerning the vaccines and every other preventable methods. When it comes to myths, it has to do with cultural beliefs. So you can't just, when you bring in a vaccine like that, you don't expect everybody to accept it at once. So it's a myth for you to say it causes infertility. There's no vaccine currently that causes that, because it goes through clinical trials before we can give vaccines. So these vaccines have gone through all the 4 phases of the clinical trials, and it is safe. So it is a myth, yes, and we just have to keep sensitizing people, advising them, talking to them, letting them know that this thing is safe. And those that have gotten it so far have no issues. There are a lot of myths apart from the, if someone would say it affects their child's, like children that have not started walking. When you give them vaccines and they don't walk on time, maybe a child that is not yet walking at 1, they will say, oh, that is just because of that vaccine, that's why the child cannot walk. So yes, there are many other ones. Some will say, oh, that site of injection is going to cause maybe the child's leg to swell or something. They are different. Some people are just afraid of the injections generally. So yes, we just have to keep sensitizing them. There are different channels. This is the social media age now. So yeah, so we do that. We send messages to people, and most of them ask us as healthcare workers. You just get calls from people who have heard about this vaccine. Is it safe? We sensitize them, we talk to them. Then also those that bring their children to the hospital, to the health center here, we sensitize them too and tell them that it's safe to take your children down. Then even schools, the schools around us, we talk to the teachers, we talk to the caregivers and the parents too, that whenever they bring any vaccine to the schools, you should accept. Yes, so we are doing that at the community level. I think the government is already doing a lot, because when vaccines come into the country, there are steps to preserve them. So I know they're already doing their own part, but the government can just help in more sensitization of the people, so that whenever they come to our states, people are already ready to accept the vaccines. There can also be incentives, go market campaigns, mass campaigns, come to different health centers, give incentives, so that whenever these people come, we give incentives and also sensitize them further on the vaccine. What we are looking at is eradication of malaria, which we know is a step-by-step, a gradual process. So what I'm thinking is, okay, let's get more people to get the vaccines, and before you know it, a lot of people will be safe from the sudden death, the severe malaria, anemia, and all that.
As the world celebrates the World Malaria Day, Nigeria's strides in ensuring a malaria-free future offers hope to all and sundry. I am Fatima Rachel, reporting for Guardian TV.